The 7th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become finalists. Let's learn what their superpower is.
So we first became aware of Bunkerhill in the domain of incidental coronary artery calcification screening. So in one example, we found a patient who came in, they had a chest CT for lung nodule screening, and they were flagged by the algorithm having a significantly elevated CAC burden. And so based upon that, we referred to cardiology. It ultimately resulted in coronary artery bypass graft, so an actual surgical intervention that we feel like really saved this person's life. So workflows we have really going on now, we have radiology actionable findings, lung nodule navigation, referral prioritization across multiple areas, hem-onc, GI, and so forth. Aspects of prior authorization workflows, case mix index optimization, obviously CAC, and so forth. I think we have 9 workflows at this moment that are active, and at least another 2 or 3 that are basically begging to come to life as soon as we can let them.
Now hear in their own words why they should win.
At Bunkerhill Health, we've built CareBricks, a generative AI platform for clinical reasoning and action. Our mission is simple: to close the gap between what we know AI can do in healthcare and what AI is actually doing in healthcare today. CareBricks allows health systems to customize and deploy clinical workflows powered by 3 layers. First, our knowledge layer has access to hospital-specific protocols and the latest clinical guidelines, and it also continuously ingests and processes every patient's data, imaging, reports, labs, and so on, to create a complete snapshot of their full history. Next, this context is fed into our reasoning layer, powered by our suite of FDA-cleared algorithms and the latest large language models to surface insights, flag risks, and determine appropriate next steps for each patient. Finally, once next steps are identified, CareBricks then completes them through our action layer, automatically placing orders, generating referrals, writing back to the EHR, sending notifications to providers and patients, and more. Our superpower lies in the ability to operationalize and scale this knowledge, reasoning, and action framework to any patient population for any clinical use case. Health systems use CareBricks to identify patients with untreated cardiovascular risks, flagged by our FDA-cleared algorithms, and automatically follow up with providers and patients to ensure they receive timely life-saving care. That same flexible framework powers dozens of other workflows, from accelerating prior authorization so patients access critical treatments without delay, to prioritizing referral queues so patients with the most urgent needs are seen by specialists sooner. CareBricks workflows impact millions of patients at the Cleveland Clinic and dozens of other hospitals nationwide. For tens of thousands of patients, it has surfaced unseen risks, accelerated access to treatments, prioritized patients with urgent needs, and closed preventive screening gaps. Every week, health systems come up with new use cases, and thanks to the flexibility of CareBricks, they can customize and launch new workflows in days. We're showing what's possible when health systems can finally act on all their patient data, consistently, intelligently, and at scale.
Follow their journey as they reach for greatness against a very strong field. Join us October 20th for the final showdown at Health in Las Vegas to witness the winners crowned.